Hello, it's Bram Duffee with Health Communication, and welcome to class. This is the lecture supplement to Chapter 2 in Week 2 of our class, and today we're going to talk about what it's like to be a patient who actively takes part in healthcare decisions. And as a culture, we're moving away from this old school model where, the doctor was the boss and the doctor knows everything. And we're into a newer, more collaborative model in healthcare now, where patients and doctors work together as a team. So what we'll talk today about is the shift from paternalistic to collaborative models in healthcare. So let's start out by just imagine this example. Lucy. Now, Lucy is someone who goes to her doctor. The doctor prescribes her some medicine, but instead of taking it, without question, Lucy voices her concerns about potential side effects. This is a big deal. She, as a patient, is not just following orders. She's actively involved in her healthcare decisions. And this is what we mean by a collaborative model. The other example, think about someone named Peter. So Peter goes to his doctor. The doctor suggests that he gets a CT scan, but Peter says, no, thanks. No, at first, this is what, you think is best as far as what Peter says. But gosh, Peter's might just be being difficult, but really he is making a choice about his body and his health. And this shows that he has a say in the decision-making process for himself. And think about it like this. Imagine you're in a group project at school, and in this old model, it's like one person decides everything, and you just have to follow along. But in the new collaborative model, everyone gets to share their ideas and makes decisions together. So it's a more fair, and everyone feels valued. And that value can make a real difference in, whether a patient's compliant or not, or actually does good things for themselves. So because we have a patient population that can expect things in healthcare like a customer would, it's important to help the patient understand what's going on. For example, I've seen patients who don't understand why it's so important that they get that CT scan or they get blood work, or maybe just to even be evaluated by a doctor. And it could be a matter of life or death, but the patient just might not know that. So this is one important aspect to consider when you're a healthcare worker, because in the past, everyone treated the physician like a king and rarely questioned their orders. But things are different now, and we can see how that can be a good or a bad thing for a patient, depending upon how the healthcare provider guides them through that process. So when we think about the patient experience, it is a real internal thing for a patient. And when we have internal orientations to these big things in life, it's real easy to tell stories in a different way. And our patients that see us, that you interact with, you should expect that they might be telling their story in a different way. And a lot of times, so we call stories narratives. And I want to talk about some of these narratives in health communication. And, narratives help us make sense of our experiences. And there are 3 different kinds of narratives that commonly get shared with us. And I want to get into each one just to mention so that we can think about the perspective of that person who has that particular narrative that you interact with in their healthcare journey. And so the one person that you might interact with would be someone who's displaying a restitution kind of narrative. And to have a restitution kind of narrative, they will be able to tell stories about getting back to normal after being sick. So it's like imagining a superhero who loses their powers but then gets them back and saves the day. The cancer survivor who talks about their journey from the diagnosis to recovery, and that kind of perspective is sharing a restitution kind of narrative. And it's like when you get a cold, you take medicine, you feel better again. They're jazzed up to tell you about about that. And that's even if they're not at the end of that journey. You could expect someone in that framework is still able to tell a restitution story, a restitution narrative. Another narrative that I want to mention is a quest narrative that you might hear from patients. And a quest narrative would be something like, if you think of a story as like this epic quest where the hero faces challenges and grows stronger, right? And someone with a chronic illness who finds new purpose in life and maybe tells others about that. And that kind of person is going through a quest narrative. It's about accepting this new normal and then growing from it. For example, like if a student struggles with a learning disability, but then finds new ways in school to make it through, and then that means they're living a quest narrative of growing. Just like if the diabetic patient would be interactive with the nutritionist in the discussions to work to get better. Those are all orientations towards that quest. So we have talked about the restitution narrative and the quest narrative, but I want to also talk about the chaos narrative, because these happen and we hear them from patients. These are stories that are messy, unstructured stories where things seem to be falling apart. It's like a jumbled puzzle where pieces are everywhere and there's no clear picture. Folks that are in the middle of a health crisis, they may just be in a spot where they feel like there's no end in sight. That is the kind of thing that we hear from a chaos narrative. And so we think of it like if someone's having a really bad day where nothing goes right and you just can't see how things will get better. And I see chaos narratives like this happen in patients who are terminally ill and know it, or patients who are having chronic pain that can't be resolved. Chaos narratives in folks who are in deep states of depression because of their illness, or because they might be stuck in a nursing home. But these are the orientations that we think about of what it's like to be a patient in that perspective, and what their kinds of stories would tell based on where they're at. When we think about patient preferences and their experience and their orientation, not all patients are the same. And they don't all want the same things. Some people might prefer to not know every detail about their condition because it makes them anxious. For example, someone who just learned that they have a genetic risk for a certain disease, they might just choose not to dig into that scary information and just only focus on living life to the fullest. But others might prefer to let their doctors or family make decisions for them. And this can be because medical language is confusing, or it can be because they trust their doctor's experience more than their own judgment. It's like when you let your parents decide what's best for dinner because you trust their choices and are overwhelmed by just too many options. That's the kind of orientation that some folks take, and we have to understand those situations so that folks don't get victimized, and they understand what's happening to them when it's important. And so that's why we have certain things called decision aids. And decision aids are tools that are designed to help people make informed choices about their healthcare options. So they provide information and help patients clarify what's important to them. So, for instance, a decision aid might help a woman who's diagnosed with breast cancer understand her treatment options, like the potential side effects and the survival rates. In this way, she can make a choice that fits her values and lifestyle. Imagine you have to pick a new video game, but there are so many options. And a decision aid is like a guide that explains each game's features and what other players think about them and how they match what you are interested in. And it helps you make a choice that you'll be happy with. And so it may depend on your lifestyle or a particular medical concern. You have to think about those choices that have to that go into things that happen where they may have an infected limb, and that infected limb is rotting to the core, and their doctors telling them they have to cut it off to save their life because, you know, the infection might be spreading. And I see this in cases, not just like in diabetic infections, which is really known, but I've also seen flesh-eating bacteria cases. And so these kinds of things are, I'm sharing with you in a dramatic sense so that we can think about what's best for that patient and how do we communicate with them in a way so that we can be approaching them with the information that they need so that they can do what's best for them. And so I just want to say, if you've got to this part, thanks for listening. I hope this gives you a clearer picture about how important it is to take into account these kinds of patient perspectives when it comes to healthcare decisions.